Randy Huntington from Wasatch Mental Health. I'm a licensed clinical social worker, and I've worked for Wasatch Mental Health for 25 years. I live here locally in Spanish Fork and been here for about 22 years, and so I'm a local person. Many of us are on edge because of what's happening. This is unprecedented times. And one thing I think it's important to mention is that people are having normal reactions to abnormal circumstances. So when we talk about anxiety in general, one of the things that's important is to recognize that anxiety is normal and actually healthy. On one end of the spectrum, if we didn't have any anxiety, we wouldn't get out of bed in the morning, right? And on the other end of the spectrum, if it's overwhelming you, you're having panic attacks, or you're not being able to leave your home, or you're not being able to do your daily functions, then it's overwhelming, and that's not healthy either. But there's this normal space that anxiety is helpful and a good thing for us. It's not helpful if it becomes more overwhelming. I think maybe talking about what healthy anxiety is in the news and the media, education is powerful. It's really important that we pay attention to what is being said and what we're being asked to do and how we're trying to do social distancing and practice good medicine and listen to the experts and the scientists around how to work with this very challenging and difficult situation. Too much exposure, though, to the media, having the news on constantly, particularly for our children, or even adults, just kind of amps us up a little. And so it's important to have an appropriate amount of education. It's important to know exactly what's going on. It's important to pay attention to those metrics around COVID. And it's also important that we have to limit our scope around that. When we don't have control over something, then we tend to want to get control over something. And so we do all kinds of things to get control. Some of those things are healthy and some are unhealthy. You just mentioned a couple on the non-healthy side, as we may drink too much alcohol or caffeine, or we may overeat, sitting around overeat or undereat, or not get enough sleep. You know, all those kind of things are means or ways of trying to gain control. Healthy things could be engagement, obviously, with relationships and with our children and with those people we care about and love. And so it's important to recognize that we have this need to control things, and we have to ask ourselves why we're doing what we're doing. Information is information is information, and it depends where we get it. You know, is it factual based? Is it based out of fear? Sometimes we like to sensationalize things and make them bigger than they are. That's a form of gaining control too. So it's important that we keep that in perspective. Yes, the police are responding, but they're being more judicious, right? EMS and fire, and those folks that are trying to protect us, they're being more judicious. They're maybe screening calls just a little bit more, but if you have an emergency, they're gonna come. I think the hospitals and doctors and nurses and health professionals, both medical and psychiatric, are really doing the best they can to try to triage and make appropriate and take measured responses, that we're not overreacting, but we're not underreacting either. If we're panicked, we're not thinking about others and relationships. We do have to shift our mind a little. We need to make concerted efforts to reach out and touch people in terms of relationships. One exercise that's really helpful is if you can think about somebody in your life who's influenced you. It could have been a mom or dad or brother or sister or friend or someone who has influenced you, and what would it be like to just reach out to them on social media? Maybe it's sending a text or an email or calling them on the phone and just having a conversation and making an effort. What would it be like to say, you know what, we haven't talked for a couple years, and I just have this memory of us being together, and I just love that. And you were such a mentor to me in this, you know, in my growing up years, and meant so much to me. If we make those kind of connections and efforts, it helps them, but it also helps us. We express our gratitude and helpfulness toward them. Those kind of things are really important. It's also important that we, if we're feeling anxious or upset, it's important to get that out. Sometimes talking is our best friend with being able to get some of that out. Sometimes writing in a journal and having a conversation with ourselves getting some of what's bothering us out can be really, really helpful as opposed to keeping it all in. And then we just get more and more stir crazy. One of the best techniques that I know of is to think about what it was like to be 16, if you have a 16-year-old, or what was it like for me to be a 3-year-old, right? And playing with a 3-year-old could mean that I got to get on the floor and play blocks, and be very cautious about imposing your own will, and instead just be very curious and observant about what they're doing. And if they're reading a book or they're watching something, or what are you reading, or tell me about that, or what are you doing there? Just giving little prompts to try to help them join their world. Single parents, my heart goes out to them because they have double trouble, and they're doing both things at the same time, being a parent on both sides, and that may be bringing home the paycheck or the money, and also trying to do the laundry and feed the family. It's even more challenging for them. I think recognizing that there are people that care for them and they're around them, that you're not in this by yourself. Being able to reach out to people that you have trusted and have been helpful to you in the past. There's no other way to get closer to someone unless you're vulnerable. And most often, the more vulnerable we are with someone, the more meaningful the relationship is. For example, there's no one in the world that can hurt me more than my wife. That's my relationship with her. Second to that would probably be my children. But that's how much investment I have in the relationship. And so the more vulnerable we are with someone, the more potential we have of being hurt. And so being vulnerable could be talking or reaching out, and that's why it's really difficult for us. It's a struggle for us to be vulnerable and allow ourselves to be uncomfortable sometimes. People who have a mental illness or significant chronic illness, those symptoms tend to get bigger. Right? If somebody has a major depression, for example, or even if somebody has schizophrenia and they have delusions and or hallucinations, and then they have a stressor like COVID, those things tend to get more exaggerated or bigger. If you don't know how to say something, or you don't know what to say, so what? Say that. I don't even know what to say right now. I just feel really upset. I feel like I'm checked out. I'm like numb to this whole thing. And I don't even know what to say right now. That in and of itself can help start a conversation, because oftentimes we have feelings and we don't have good vocabulary to describe what goes on inside of us. So having those conversations with people that are more vulnerable, and if we'll allow ourselves to do that and to reach out for help, oftentimes it doesn't guarantee success, but it dramatically increases probability. If somebody says, no one cares about me, and so therefore I'm not even going to try, chances are you're probably not going to get a lot of response. But trying increases our probability of someone caring for us. There are a lot of resources out there. There's a lot of really good information right now on COVID, 19, because that's the big talk right now. Our website, wasatch.org, there's a lot of links to self-care and things to take care of ourselves. There are many resources out there if serious problems exist and they're persistent over a period of time, then professional help is useful to go to therapy. In more extreme cases, medication is necessary for people who struggle with anxiety and depression and other mental health challenges. But those are some of the resources. There's 24-hour, there's the Utah Crisis Hotline that exists, and that's statewide. So there are many different resources out there for people. You don't have to suffer in silence. It's important that you remember you don't have to do this all by yourself. We're living in a very unprecedented time. When in the world have we shut down our schools and all of our restaurants and all the things that's gone on in the world? We're living in a very strange, odd time. That in and of itself is a stressor. Our history, however, tells us that even with those more difficult times, really, really difficult times, we pull together as people. People are generally caring about people. And when you think about 9/11 and that tragedy that existed, many years ago, that's something that shocked our nation, our world. And look where we are today. We will get through this. It will be fun one day, maybe, to think about, remember when we had that COVID-19 thing? How we adjusted and how we overreacted in some ways and maybe underreacted in some ways. But I'm very confident that we're going to get through this. We'll get through it together. I think we'll get through it together as a community. Spanish Fork is a wonderful community to support each other and care about each other and help one another out. And I'm very confident we're going to get through this.